I was the First Minister when the pandemic struck. There's a large part of me wishes that I hadn't been, but I was, and I wanted to be the best First Minister I could be during that period. It's for others to judge the extent to which I succeeded.
Good morning, my lady. Today's witness is the Right Honourable Nicola Sturgeon, MSP, in the Scottish Parliament in response to a question about whether you would order a public inquiry into the COVID-19 outbreak in care homes in Scotland. You replied as follows: "Of course there will be a public inquiry into this whole crisis and every aspect of this crisis, and that will undoubtedly include what happened in care homes." So at that stage, you knew that there would be a public inquiry in the future into the Scottish Government's response to the pandemic generally?
I always assumed there would be a public
inquiry. It was your instinct to think that you knew best, rendering the published strategies of the Government and the apparent advisory structures around you nothing more than, to use Mark Woolhouse's words, rhetoric. It was your instinct to seek to portray yourself as open and honest with the public, but at the same time to keep from them important elements of the management, such as the Nike conference, care home deaths, and the advice around the rugby, which allowed COVID into Scotland in the first place.
I am not sure that that last statement would be established by facts, but I stand to be corrected. That is why the early advice around care homes focused very much on isolation and keeping people separate. And notwithstanding the limited availability of the testing at the time, there was a concern that testing on its own would not be sufficient to guard against those risks. On care homes in particular, I think there are very serious issues for all of us to reflect on here. Testing is undoubtedly a significant part of that. Discharges from hospitals in particular are a very serious part of that. And I'm not shying away from that. But I also think there are other issues around care homes, and all of which the Scottish Government has to take responsibility for, that we mustn't lose sight of in a focus only on testing. The report that Public Health Scotland did later in 2020 about discharges from hospital showed that almost all care homes in Scotland over that period from March through to May had discharges from hospital. But only a third of those care homes had an outbreak of COVID or had residents who died from COVID. So that suggests that, yes, discharges and the circumstances of discharges must be looked at seriously. But that would suggest, and the number of deaths were very heavily concentrated in relatively small numbers of care homes. So there are other issues, I think, that we need to probe very, very seriously around the structure and the size of the care home sector, the resources and the regulation in care homes. These are all profoundly important issues. Testing is a significant and important part of that. But my view is that there are other aspects of that that we must also make sure we consider in the course of a fuller examination around the situation in care homes.
Well, that just goes back to the latter part of the question, that with all that uncertainty and the lack of capacity on testing, would it not have been prudent to err on the side of safety and not discharge to care homes?
When we were in the early part of the pandemic, and I'm talking here about late February into March 2020, the objective was where somebody didn't have the medical need to be in hospital, it was better for them to be discharged. I mean, that is genuinely true at all times, but we were watching on television in countries like Italy, hospitals filling up with COVID patients.
Were you aware of recommendations made in April 2020 to the Scottish Government in relation to the restriction on visiting care homes being increasingly disproportionate and failing to meet the pastoral needs and care of individuals, care needs of individuals, and the traumatic effect this was having on families? And if so, how did this affect your decision-making process?
In my experience and recollection, the issue of care home visiting was one of the most difficult because I was aware of the increasing distress and trauma, both to care home residents and to their loved ones, of restrictions on visiting. And that was an issue on which we were always trying to strike a balance between opening up and allowing much more flexibility in terms of visiting, but trying to guard against infection being in homes. I don't think we got that right, possibly at all, but it was not because we didn't care. It was not because we didn't try to get that right. And I have had in the past, I have at the moment, relatives in care homes myself. I understand, or I think I can understand how awful that would have been for any family with a loved one in a care home at that time.
Yet very frail people with complex needs were being moved in circumstances where you were aware of the problems of asymptomatic transfer, pre-symptomatic transfer, and the problems of false assurance. Why, therefore, was it considered in all these circumstances safer to move them at all? And would you have taken the same decision again, knowing what you know now? And if not, what would you have done differently and why?
I would desperately try to find ways of managing the situation of elderly people in hospital who didn't have a medical need to be in hospital differently, that would have, if not prevented, because in the face of what we were dealing with, I'm not sure prevention absolutely would ever have been possible, but to mitigate and minimise beyond what happened in reality. I would do everything in my power, and I wish I could turn the clock back and do different things that would have reduced the loss of life in care homes. But it wouldn't have changed a situation where leaving people in hospitals would not have been an option that was without risk. There was nosocomial infection in hospital. There were COVID patients in hospital. We didn't, thankfully, face the overwhelming of hospitals in the way that had been seen in other countries at the start of the pandemic. But hospitals would not have been a risk-free environment for vulnerable people either. And that's the context in which these decisions had to be made. And I desperately wish we could have had the ability to do things in a way that didn't result in the outcome that did materialise.
And wouldn't the retention of those patients in hospital have been the best place to meet their medical needs rather than discharging them to care homes where they were putting other vulnerable people in harm's way? Anybody
who had a medical need to be in hospital should have been in hospital. We were talking about discharge of people who didn't have a medical need to be in hospital, and discharge to their own home or to a care home was considered to be considered to be better than keeping them in a hospital environment that in itself would not have been without risk of COVID transmission. That was the advice at the time. These were the judgments that were made at the time. And yes, I think it would have been, I wish we had been able to introduce testing earlier, more comprehensively. But I don't think that in and of itself would have removed the risks of care home admission. And that's why I'm saying I think there are a variety of other issues that also need to be properly considered in terms of the circumstances of discharge to care homes. But I don't think I can sit here and say that keeping people in hospital would have been without risks, or certainly that at that time would not have seemed to me to be the situation.
Hubris does not stop a pandemic. The story of COVID in Scotland is the story of the hubris of Nicola Sturgeon, is it not?
No, I do not believe that to be the case. I I'm in the fortunate position of not having personally lost anyone to COVID. I wish with every fibre of my being that the decisions my government have been able to take could have reduced the number of people in Scotland today who did lose someone to COVID. And I am deeply sorry to each and every bereaved person and each and every person who suffered in other ways. I did my best, my government did our best, and people will judge that. But I know that every day I tried my best and those working with me tried our best to steer this country through the COVID pandemic in the best way we could.
Thank you, Ms Sturgeon. I have no further questions.
That completes the evidence for today.
Yes, thank you, my lady.
Thank you very much, Sturgeon. I don't know if I can guarantee that we won't be calling upon you again.